I grew up in North New Jersey, and I did emergency medical services in high school, which was my early lead into medicine. And then I was an engineer as an undergraduate. And surgery is kind of the natural marriage between medicine and engineering. It's both very technical while also very creative, and requires critical thinking, problem solving, and constantly kind of stimulates the mind. My philosophy is that we should be delivering patient-centered, outstanding care. It's my goal that when I'm talking to patients in the office, we discuss what they value. I want them to have a good understanding of both the surgical and the non-surgical management of whatever they're coming to see me for. And I really want, when they leave the office, that we've developed a plan tailored to best fit their values, that they understand, and that they're comfortable with. Because the best thing for me about surgery is that in the post-operative visits, when we've fixed whatever problem you have, you come in and you're doing great and you're happy, and that's just so rewarding as a physician and a surgeon to see, and I really love that. So that's what we're trying to do here.